Sentara seeks to serve the medical needs of a large community in the Mid-Atlantic region. We're focused in Virginia and North Carolina.
At Norfolk General, this is the quaternary hub of the Sentara healthcare system, and part of that Norfolk General Hospital is the Heart Hospital, which is a special purpose acute care hospital on the Norfolk General campus.
What makes us unique is we operate 11 other community-based hospitals across the Commonwealth of Virginia, and our mission is to optimize the clinical quality of the Sentara Heart program across that vast network. Wherever the Sentara brand represents itself and Sentara Heart programs are offered, our mission is to provide the same quality, the same standardized high quality protocols, and to channel patients to our network so that they're in the right facility for the right acuity of care.
We do have the capability to do virtually everything that can or needs to be done in treating cardiac problems, cardiac diseases. And we take a very multidisciplinary approach to that. We're able to bring to bear the resources of interventional radiologists, vascular surgeons, cardiothoracic surgeons, and cardiologists to provide the best possible outcomes and options for patients when they come here.
The Advanced Heart Failure Center is a referral clinic that takes care of patients with advanced heart failure. That is inclusive of patients that have stage 3 and stage 4 heart failure, patients that have received heart transplantations, as well as patients who's benefited from a left ventricular assist device. I think we provide a tremendous resource. Our clinics are growing in size. We're increasing physician support as well as APC support. And for the 30 years that we've been here, every year we see an increase in throughput through the clinic. And this is a reflection of the success of the clinic as word of mouth as well as physician referrals. Again, to really concentrate on disease management as it pertains to advanced heart failure.
The structural heart program concentrates on catheter-based and novel therapies for treatment of non-coronary cardiac disease. That is valvular problems, problems with flow between the upper chambers or the lower chambers of the heart, anything wrong with the heart that doesn't directly involve the blood supply.
We now have the full armamentarium for atrial fibrillation, pretty much from catheter ablation all the way up to hybrid ablation, all the way up to the full Cox-Maze 4 procedure. And that allows us to look at all the outcomes, the complications, the costs, pretty much everything from soup to nuts.
We have participation from our cardiac surgeons, cardiac anesthesiologists, advanced imaging physicians, and interventional cardiologists, as well as our non-interventional colleagues, trying to find novel and less invasive ways to treat problems that previously either were untreatable or were the province of cardiac surgery alone. By expanding that, we've greatly increased the range of patients that we're able to treat that have severe heart problems that may not be good surgical candidates or may not be candidates for traditional approaches.
The Arrhythmia program at Sentara Norfolk consists of the gamut from percutaneous options, catheter-based options for the treatment of a variety of rhythm disorders, not just atrial fibrillation, but also for ventricular tachycardia and more complex arrhythmias, all the way to surgical options for both atrial and ventricular arrhythmias. The 5-box thoracoscopic maze procedure is a totally closed chest beating heart procedure that is accessed through tiny port incisions on the side of the chest and uniquely replicates the effects of a Cox-Maze, a formerly performed through an open chest procedure, now done using modern surgical techniques and ablation technology. The recovery from the operation is much faster, and the efficacy of the procedure is excellent, with upwards of 95% of a cure rate.
The future of Sentara Heart Hospital is, I think, bright. I believe that there is a large body of evidence now that for specialized acute care hospitals focusing on one disease process or one organ makes it an efficient and cost-effective way to deliver care.
Because we've been a leader in innovation in terms of techniques, but also innovation in studying our process, our actual results, We've been able, I think, to meet and exceed all sorts of benchmarks for outcomes, and we continue to be focused on that.